A concerned citizen who chose to remain anonymous and works as a social worker gives her first-hand account of the anxiety and suffering she and her family endured when her mother was diagnosed with COVID and then hospitalized at Katutura State Hospital.
I would just like to talk about the mental or the psychosocial aspect of this COVID-19 and the fact that I'm so dissatisfied with the efforts that our government is doing. It appears to me that really they do not know how to manage this, and there is just no protocol or procedure in place as to deal with this crisis that we are currently facing, especially in Windhoek. My own mother was admitted last week at Robert Mugabe, and she was there for 2 days, and after that she was referred to Katutura Hospital COVID ward, and we had to literally wait for 5 days to get any kind of contact or feedback about my mother's condition. Number one, if you are lucky enough that your loved one who's admitted at those wards have the energy or is physically fit to be able to manage their own cell phone, at least then you can establish contact. But if the person is in such a condition like what my mother was in, the state that she was in, she was unable to manage or hold her own cell phone. So we couldn't establish that contact with her. That's why I'm saying we had to wait literally for 5 days just to get access to her and just to establish how she's doing or her well-being. On top of that, I learned that there's only one social worker from the Ministry of Health working at that COVID ward. And I also got information that there's more than 100 patients admitted there. So my question really is, the government, did they not look at the issue of maybe deploying social workers from other ministries? I also understand that our social workers are few in the country. But really, do we not have line ministries that can allocate social workers, or social workers can volunteer and work on a shift basis within those COVID wards? The efforts that the one social worker currently working there has done has been remarkable. But it's also not fair for us to expect one social worker to serve more than 100 patients. She does video calls and she does voice calls just to give a general update. But if you are lucky enough, you'll get that update once in a week or once in 2 weeks. So maybe I would recommend that the government deploy more social workers. Another suggestion would also be like a call center just allocated for the COVID wards where there's so many people admitted. Because as we all know, one of the things that that is done in the medical world when a person has a terminal illness like COVID, family relations and establishing family relations is so important for the recovery of that person, or at least just for the person's health status to improve. But imagine if you are COVID positive and you are in such a position that you cannot even care for yourself, you don't have energy, you're so weak, and still on top of that you are isolated from your own family. I can also understand that looking at the virus and the fact that it might be airborne, there is a lot of contributing factors maybe that made the government to make this decision. But then in the absence of us having that contact and spending time with a loved one, in the absence of physical contact and the fact that we are isolated from our loved ones, did the government not sit down and think about other ways or means for us to establish that contact? You won't believe, since we started talking with my mother, and we've seen a remarkable improvement in her health condition just because of her being able now to talk to us on a daily basis. Another thing that is also of great concern is my mother has a medical aid, a very good medical aid. She can afford to be admitted at any private hospital in Windhoek. But since the onset of her being sick and since the onset of us finding out that she's positive, we are unable to get an admission at any private hospital in Windhoek. Even the private doctors are not willing to help. So my question is really, what is our private sector also doing with regards to COVID-19 patients and having to care for or receiving that medical service when they're at the stage where they are so sick? On top of that, all of us has also read in the past 2 weeks about politicians being admitted. politicians being admitted at private hospitals. So my question is, how did they get a space for the politicians if they cannot even admit an ordinary Namibian from the street? There again, one can see that there's even favoritism, or people are getting certain privileges just because of their status, even with COVID-19. It's something else. I wish that one of our politicians can come to this Katutura COVID Center, Katutura Hospital COVID Center, and just come and look at the situation there. Every day between 3 and 4, we have to take food items or any other need for our loved ones at the gate. They receive us at this gate. And while you are at this gate, they come and remove bodies of people that didn't make it during those visiting hours when there's lots of people gathered. They come and remove bodies with bakkies, Minister of Health bakkies. On top of that, at this very same gate, the people is so insensitive. I can understand maybe they are overworked, but really, you are called at the gate thinking that maybe it's a news or a good news. Then you are told at the gate that a loved one passed on. I've witnessed this for the past week that my mother have been admitted there. Are there not other avenues that can be done really with the handling of this? We are all in such a state emotionally, mentally, about we are all fearful, we are scared, we don't know what will happen, we are all scared of the unknown, we don't know even what to use, what not to use. There's so much going on social media about the vaccination and what really works. So being in this anxious state, and you have a loved one in that COVID ward where it feels like the person is maybe in a prison and you cannot have access to your own loved one or even a regular update. Really, people, is this what our government can offer to our Namibian nation? When my mother was admitted at Katutura COVID ward, her saturation was less than 60, less than 50. In terms of the treatment, I cannot really say that the treatment was poor, because the time that she got with the medical staff, at least they were observant. But one thing really that affected me so much was that they were not too sure, or they didn't follow all the medication that we brought in upon admission, and that all the type of chronic illness that she has, we've listed it upon admission. But we learned on Saturday that she's not been getting all of this medication, and that the doctor wasn't fully aware of all of the treatment that she needed. And funny enough, you won't believe it, that we only got to establish contact with the doctor after we had to call numerous people, and people that know other people that could give us numbers of doctors in the COVID wards. The setup that I got is that there's a male section and there's a female section, and there's a respiratory ward section. And all of these sections have telephone numbers, and that there are doctors working in those different sectors. I had to call friends of friends. They could direct us and give us numbers of those sections. And we only got through with that after 6 days on Saturday. And that is when I finally got to speak to a doctor and get an update, and also tell the doctor what medication my mother needs and the treatment that she's currently on. So in terms of treatment, I would say really, in my opinion, if I look at it, there might be a lack of medical staff in there. And that is of a great concern. Imagine if they only send in one social worker. What more about the medical team? When we finally made contact with my mother, I realized that she's very depressed, and she had already shown signs of depression prior to us bringing her here to Katutura COVID ward. And that time she was still at Robert Mugabe, and we had to emotionally prepare her that once you are transferred over, we will not be able to see you. And already there, she became distant, she became quiet. And when we established contact at the COVID center after 5 days, I could sense that my mother is very depressed. And because she's a family person, she's used to being with us every day. We stay in one house, her grandkids. And I think that also greatly contributed to her deteriorating health state. Because after we could establish that contact after the 5 days, there was such an improvement in her health that today, as I'm standing with you, I just spoke to her and my tears are just rolling tears of joy because she's now talking and she's laughing. So really I feel for the patients admitted here, and especially thinking that they are seeing other patients around them dying daily basis. People are dying in the center. That alone should be depressing also.